Mental disorders are indeed prevalent in Europe, as they are in many other parts of the world. The prevalence rates of specific mental disorders can vary depending on the country, the methodology used in studies, and other factors. However, I can provide you with some general information on the prevalence of the mental disorders you mentioned in Europe based on data available up until September 2021. Depression. Depression is a common mental disorder characterized by persistent feelings of sadness, loss of interest or pleasure, and a range of other symptoms. According to the World Health Organization, WHO, depression affects approximately 4.4% of the European population. However, the prevalence rates can vary across countries, with some studies reporting rates as high as 8 to 12%. Anxiety disorders. Anxiety disorders, including generalized anxiety disorder, panic disorder, and social anxiety disorder, are also common in Europe. The estimated prevalence of anxiety disorders in Europe is around 14%, according to the WHO. Again, rates can vary between countries. Bipolar disorder. Bipolar disorder is a condition characterized by alternating episodes of depression and mania or hypomania. The prevalence of bipolar disorder in Europe is estimated to be around 1 to 2% of the population, although rates can vary across different studies and countries. Eating disorders. Eating disorders, such as anorexia nervosa, bulimia nervosa, and binge eating disorder, are serious mental illnesses that can have severe physical and psychological consequences. The prevalence rates of eating disorders in Europe are estimated to range from 1 to 4% for anorexia nervosa and 1 to 2% for bulimia nervosa, with binge eating disorder being more common. It's important to note that these prevalence rates are approximate and can vary depending on the specific study, population sample, and diagnostic criteria used. Mental health is a complex issue, and accurate prevalence data can be challenging to obtain due to underreporting, stigma, and variations in research methodologies. Additionally, it's worth mentioning that mental health awareness and diagnosis rates have been improving over time, which could influence prevalence estimates. Schizophrenia. Schizophrenia is a chronic mental disorder characterized by hallucinations, delusions, disorganized thinking, and other symptoms. The prevalence of schizophrenia in Europe is estimated to be around 0.5 to 1% of the population, although rates can vary across countries and regions. Post-traumatic stress disorder, PTSD. PTSD is a mental disorder that can develop after experiencing or witnessing a traumatic event. The prevalence of PTSD in Europe varies depending on the population studied and the specific trauma experienced. Rates can range from 1 to 3% in the general population, but they can be higher in specific groups, such as war veterans or refugees. Attention deficit hyperactivity disorder, ADHD. ADHD is a neurodevelopmental disorder characterized by symptoms such as inattention, hyperactivity, and impulsivity. The prevalence of ADHD in Europe is estimated to be around 5 to 7% in children and adolescents. The rates tend to decrease in adulthood but can still affect a significant portion of the population. Substance use disorders. Substance use disorders, including addiction to alcohol, illicit drugs, or prescription medications, are a significant concern in Europe. The prevalence rates of substance use disorders can vary widely across countries and substances. According to the European Monitoring Center for Drugs and Drug Addiction, approximately 4.5% of the European population aged 15 to 64 had used illicit drugs in the past year, while alcohol-related disorders affected around 4.1% of the population. Obsessive-compulsive disorder, OCD. OCD is a mental disorder characterized by recurring unwanted thoughts, obsessions, and repetitive behaviors or mental rituals, compulsions. The prevalence of OCD in Europe is estimated to be around 1 to 3% of the population. Rates can vary across countries and age groups. Personality disorders. Personality disorders encompass a group of mental disorders characterized by persistent patterns of thoughts, feelings, and behaviors that deviate from cultural expectations and cause significant impairment. The prevalence rates of specific personality disorders in Europe can vary. For example, borderline personality disorder is estimated to affect around 1 to 2% of the population, while other personality disorders may have different prevalence rates. Sleep disorders. Sleep disorders, such as insomnia, sleep apnea, and restless leg syndrome, are common in Europe. The prevalence rates of sleep disorders vary depending on the specific disorder and population studied. Insomnia, for instance, can affect up to 20 to 30% of the European population, while sleep apnea is estimated to affect around 4% of adults. Other mental disorders. In addition to the disorders mentioned above, there are various other mental disorders that can be prevalent in Europe. These include but are not limited to dissociative disorders, somatic symptom disorders, adjustment disorders, and neurodevelopmental disorders, e.g., autism spectrum disorder. Suicide. While not a specific mental disorder, suicide is a tragic outcome often associated with underlying mental health issues. Suicide rates can provide insights into the burden of mental disorders within a population. According to the World Health Organization, WHO, Europe has relatively high suicide rates compared to other regions globally. The rates can vary across countries and even within regions of the same country. Factors such as access to mental health care, social support systems, and cultural attitudes towards mental health can influence suicide rates. Children and adolescents. Mental disorders are not limited to adults. They can also affect children and adolescents. In Europe, studies indicate that mental health issues among young people are a significant concern. Prevalence rates for disorders such as depression, anxiety, ADHD, and eating disorders can vary among different age groups and populations. It is crucial to address mental health concerns in children and adolescents to support their well-being and development. Regional variations. Prevalence rates of mental disorders can differ across regions within Europe. Factors such as socioeconomic conditions, cultural influences, and healthcare accessibility can contribute to these variations. It's important to consider the unique challenges and needs of specific regions when addressing mental health issues. Changing prevalence. Prevalence rates of mental disorders may change over time due to various factors, including shifting diagnostic criteria, changes in societal attitudes towards mental health, and improved awareness and diagnosis. It is essential to monitor these changes to adapt mental health services and interventions accordingly. Impact on society. Mental disorders have a significant impact on individuals, families, and society as a whole. They can lead to functional impairment, reduced quality of life, increased healthcare costs, and productivity losses. Recognizing the prevalence of mental disorders and implementing effective mental health strategies is essential to reduce this burden. Gender differences. The prevalence of certain mental disorders can vary between genders. For example, depression and anxiety disorders tend to be more common in women, while conditions like autism spectrum disorder and attention deficit hyperactivity disorder, ADHD, are more frequently diagnosed in males. Understanding these gender differences can help in tailoring appropriate interventions and support. Comorbidity. It is common for individuals with mental disorders to have multiple conditions simultaneously, which is known as comorbidity. For instance, depression and anxiety often coexist, as do substance use disorders and mood disorders. Comorbidity can complicate diagnosis and treatment and may require a comprehensive approach to address all underlying conditions. Stigma and help seeking. Stigma associated with mental health can act as a barrier to seeking help and support. This can lead to underreporting and underestimation of the prevalence of mental disorders. Addressing stigma through awareness campaigns, education, and promoting a supportive environment can encourage individuals to seek help and reduce the impact of mental health conditions. Impact of COVID-19. The COVID-19 pandemic has had a profound impact on mental health worldwide, including in Europe. The stressors associated with the pandemic, such as isolation, loss of loved ones, financial strain, and uncertainty, have contributed to an increase in mental health issues. The full extent of the impact on prevalence rates is still being studied, but it is clear that the pandemic has exacerbated existing mental health challenges. Variations in healthcare systems. The prevalence of mental disorders can be influenced by variations in healthcare systems across European countries. Factors such as access to mental health care services, availability of specialized professionals, and insurance coverage can affect diagnosis, treatment, and overall prevalence rates. Risk factors. Various risk factors contribute to the development of mental disorders, including genetic predisposition, environmental factors, such as childhood trauma or chronic stress, substance abuse, and socioeconomic disparities. Understanding these risk factors can help in implementing preventive measures and early intervention strategies. It's important to remember that addressing mental health requires a comprehensive approach that includes awareness, prevention, early intervention, accessible and quality healthcare services, and ongoing support. Mental health should be prioritized as a crucial aspect of overall well-being, and efforts to reduce the prevalence of mental disorders should be integrated into healthcare systems and societal frameworks.